Thank you very much for allowing me to speak today, and I want to first say this is not 50 Shades of Grey, so we're not talking about anything concerning that book. But this is about the different ways we age and telling you a little bit about what aging looks like in Louisiana. First, let me give you a few statistics. First, I guess most striking is that we are now going to be, people over 65 are going to be outnumbering children in the population by the year 2024. So that's only 10 years away, we'll be outnumbering children. 16.4% of Louisiana residents are age 65 and older in 2020. That's going to be almost 20% by 2030. And what that means is we're going to have increased demands on long-term care. The Southern Legislative Conference estimates that 70% of people, many of us, age 65 and older, will need long-term care at some point in their life. Many will rely on taxpayer-funded health program, Medicaid, and other taxpayer programs for that care. We are going to continue to have costs of health care continue to rise, and care for older adults is expected to consume a much larger portion of our state budget over the next several years. So a lot of demands on that system as we age in Louisiana and the population becomes older and older, not just in Louisiana, but in the whole United States. So what do we really want when we age? This is something I think everybody can agree on. We want our independence. We want to be able to live on our own and with our families, with our children. We want to be able to volunteer in our communities, be a part of our community. So we want to learn new skills. We want to volunteer. Most important, we want to be able to stay close to our loved ones and be in our own homes. So what does it mean if we have to need long-term care supports and services? Well, that means a broader range of things. It could be something just a few hours a day that you might need, or you might need 24-hour care. Many people are going to have chronic illnesses or disabilities that's going to result in some loss of your independence. Again, what most of us want to be able to do is stay in our homes. That's not necessarily true in Louisiana. I'm going to talk about that in a few more minutes. But for the most part, we can be guaranteed one thing. We can be guaranteed that we can get a nursing home. Because if you're in the Medicaid program, which Louisiana is, that means that the Medicaid program covers nursing home care. Now that's if you're Medicaid eligible. If you are independently wealthy, you have some other options. You can get private care at home. You can pay for assisted living. Assisted living is not paid for by Medicaid, but you have other options. However, even with those other options, many people are still going to be in the same nursing homes that are funded by Medicaid, because the nursing homes are Medicaid and Medicare funded primarily. There are some private facilities, but many of them are funded by the government in some form or fashion. And a lot of people don't really understand the difference between Medicare and Medicaid. As a matter of fact, you'll hear lots of people sometimes say Medicare instead of Medicaid, or vice versa. Medicare is a totally federal program. It is not funded by the state. It's not established by the state. Whereas Medicaid is a state program. We pay for it with state funds that are pretty much matched with a lot of federal funds. For instance, our Medicaid budget is right about $18 billion. Most of that is federal funding. Over $13 billion of that is federally funded. So Medicare does not, a lot of people also think that maybe Medicare will cover my nursing home costs and other long-term care costs. It does not cover nursing home costs. It covers the medical services in nursing homes, but doesn't cover room or board. So again, a lot of people mistakenly think, well, I've got Medicare, I'm going to be okay for my long-term care costs. You're not. And a lot of the other costs, personal services, sitters at home, are also not paid for by Medicare. Medicaid does pay for nursing home costs, and there are also some home and community-based services that Medicaid pays for. However, they're not really available to many people, and I'll tell you why in a few minutes. So most of us have institutional options, which are nursing homes, licensed homes. Basically, we have about over 17,000 that were in nursing homes in Louisiana as of August. It costs between $45,000 and $52,000 per person for a nursing home. So not cheap, they're pretty expensive. And many of those, again, are paid for by us through tax dollars, through Medicaid. And again, I mentioned assisted living, that's private pay, it's not covered by Medicaid, it is something you have to have your own money to provide those services. So we know we can have some institutional options. Unfortunately, here's probably the grayest or the darkest gray part of aging in Louisiana. Our nursing home quality, and for those of you who have dealt with nursing homes either through with somebody you know, your siblings or parents, you know some of this. We have really bad nursing homes in Louisiana. And I mean, so bad that they're the worst in the United States. And I'm going to give you some of the statistics. USA Today reported that out of the nursing home quality rating, which is 1 to 5, the best was almost 4, which was in Hawaii. So if you want really good nursing home care, you can go to Hawaii. Not a bad place to retire anyhow, right? But in Louisiana, the worst, just a little over, I can't quite read that, it's 2.34. So again, the very worst out of all 50 states of nursing home quality. USA News reported in CMS data, and this one, probably when I was doing this research, bothered me the most. 42.5% of Louisiana nursing homes were designated as problem facilities. So there's almost a 50% chance that you're going to get a nursing home that is a problem facility. That means they have staffing problems, they have problems with infection control, they have problems with health and safety, abuse, neglect. They're really poor nursing homes. And then the last statistic is US News does a survey of nursing homes quality nationwide, and this is a very recent survey as of May of this year, ranked last. Louisiana's ranked last. And you know, these statistics really bother me because they're very available. And you know, we have other statistics that show, for instance, we do really poorly in education. And we take steps to remedy this. As you may know, there are very few steps that have been taken to remedy nursing home quality in Louisiana. And again, you know, many of you know the incident that happened after Ida with evacuations. Again, just really pointing to the really poor nursing home quality we have. There are some national efforts. They just approved new rules in April that are changing the minimum staff ratios, especially for registered nurses. They have to have registered nurses 24 hours a day. Also changing the ratios for nurse and nurse aides. But the Kaiser Foundation found that probably only about 3% of Louisiana nursing homes are can actually meet those standards. So what that means is that there's going to have to be a lot of changes, and it's also an unfunded mandate. It's going to cost for those nursing homes to be able to improve those. So again, costs that we're all going to end up paying for. So one of the things I tell people all the time, so we're paying for the nursing home cost of really poor quality. It costs more money than home and community-based services, yet we continue to provide those institutional services rather than having additional home and community-based services. We have a broader range of services that are paid through Medicaid, things like long-term care, personal care services, which provide attendance services for individuals. There's a PACE program, which is a really good program. It's a program for all-inclusive care for the elderly, and it covers all sorts of things for individuals on a daytime basis. So people can stay in their homes, go to these programs. There were only 3. There's now a new one in Alexandria that's opening up, but it's Baton Rouge, Lafayette, and New Orleans. So again, you have to be in the right place, and very, very few services that are really available for these day services. Same thing with the adult day waiver. Again, very limited services, and probably the best home and community-based service we offer is a community choices waiver. However, if you want that waiver, there's a waiting list of 5,700 people before you can get it. So the chances of you getting that waiver before you actually die are probably not very good. So they, again, very limited home and community-based services. So what needs to happen, and this is my opinion, but first, I wanted to tell you about what we do with spending. Louisiana spends 20% of its long-term Medicaid funding on home and community-based programs, compared to the rest of the nation that spends 62% of their long-term care funding on home and community-based services. So we are way off in terms of how we spend our long-term care funding. So that needs to change. We need to provide more funding for home and community-based services, and also at the same time increase our quality of nursing homes. Those are, I mean, it sounds really simple. The two big things we need to do. It's been very, very difficult to make these changes in Louisiana. So hoping that over the next couple of years that we will start to make some of these changes and we'll see some differences. I certainly hope it happens before I need nursing home care, which may not be too long, so it needs to happen quickly. And so the reality is, many of us aren't going to get what most seniors want when they age. We're not going to get to stay in our homes. We're going to be in a nursing home, and unfortunately in a not very good quality nursing home. So these things should concern everyone, because like I said, even if you don't have Medicaid, these nursing homes are nursing homes that are private pay as well. And also, Medicaid budget is such a significant part of our state budget. We have to think of ways to do it less expensively. Again, why we should be focused on home and community-based care versus institutional care. So what can you do? There's some things, I love to tell people there's some ways they can advocate. Now, she mentioned earlier, I do most of what I do, but now most of the time is volunteer. I belong to the Live at Home Coalition, which is a coalition of a lot of different businesses that are banded together to try and do those two things I just mentioned, and increase our home community-based services at the same time, increase the quality of nursing home. You also can join AARP. Most of us are members of AARP because you get really good discounts, but they do a really good job of advocating. They're always looking for advocates to go to the legislature, to talk to legislators about what needs to change in terms of our long-term care in Louisiana. There's a contact you can have. The last thing I'm going to talk about, and hopefully can give a few minutes for questions. This is my favorite slide of all, because there's other things you can do to reduce your ability, your need to use long-term care. I mentioned 70% of us are going to use long-term care after the age of 65. But what you really can do is there are things you can do to change that for yourself, where you don't need long-term care. There's tons of resources out there about how to live longer and live healthier. If any of you have heard of this book, it's called Outlive. It's a wonderful book. It's about living not just longer, because nobody really wants to live to 100 if they don't have a good quality of life. It's about how to live healthier, and whatever years you have remaining, to do it in a way that you can really enjoy your kids and your grandkids and then live independently. He talks about that there are 4 major things that are going to get us, and this doesn't cover everything, but these are the major things that will happen to us to need long-term care. Diabetes and the problems that it occurs long-term, cardiovascular diseases, neurodegenerative, which are Alzheimer's, dementia and cancer. And there are strategies for all of these. A lot of people say, well, cancer's cancer. Are there really strategies? There are. There are preventative things that can be done. There are preventative testings that can be done for everything that I just mentioned. And there are 5 things that we can all do. And the way Dr. Attia puts it in his book is you don't have to be perfect. You don't have to exercise every day. You don't have to exercise, an hour and a half intensely every day. Walk every day. Do just some simple exercise, and do exercises you enjoy. She mentioned I'm addicted to pickleball. It's a very social sport, and most anybody can do it, even though they may not have a whole lot of athletic ability. I have the absolute worst eye-hand coordination, and I can still play pickleball. So again, find something you really like to do and start doing it, and doing it often. He believes very strongly that exercise is the number one. Nutrition is, of course, very important, but he doesn't say you need to do a certain diet or a certain, you don't have to vegan diet or a keto diet. It's all about moderation and, stopping the junk food and the processed food. And the more you can do that, that will also help with your longevity. Sleep, a lot of people don't realize how important sleep is to health. You gotta get a good night's sleep. You gotta plan to be more regular about your sleep and figure out ways to make sure you can sleep all night, whether that's, using a CPAP machine if you need it, which most people hate, but it does help your quality of sleep. So there are things, again, you can do. You can go outside and be outside in the air during the day that will also help you sleep more at night as well. And then emotional health, people forget about this. It's very, very important to keep our relationships and our social relationships going and be mindful of our mental health. And if we're depressed, to do something, go see somebody, talk to somebody, and take care of your mental health. And the last is medicine. There's so many things modern medicine can do. You hear lots of things. Should I stay on this hormone? Should I stay on the lipids? Am I doing, should I do any of these things? Or should I just get off all medicines? Medicines work. And, whether that's Ozempic, if it's going to help you lose weight, these things are not bad things. These are things that can really help. And again, you need to do it, of course, under a doctor's care, but supplements and other things that they're out there for a reason because they really do help. So anyhow, those are the 5 things that he says in his book, and I believe very strongly in. So I just encourage everybody to really think of things they can do, start doing differently to live a longer life and not have to have that long-term care. That's how most of us want to be able to age. And that's it. And I have a few moments for questions.
Kathy, is it still a fact that the nursing home lobby keeps us from going and joining the rest of the country and having home care versus nursing home care?
The question was, I was asked to repeat it, is it the fact that the nursing home lobby keeps us from keeping up with other states in doing what we need to do? And that's what I absolutely believe. I faced the nursing home lobby many times in trying to get some reforms through. Literally, and Julie may remember this, but 3 years ago, we were simply trying to get a resolution passed to look at things that need to happen to improve our long-term care and aging. We could not even get a resolution passed, and we found out afterwards that 40 lobbyists were hired over a period of a week to crush a resolution. So absolutely, do I believe that? Yes. I mean, there are things we should be doing in this state to say we need to do better for our senior citizens. And our efforts have clearly been not very successful. And I believe that certainly is one of the main reasons.
Can you address how many politicians or former politicians are owners or co-owners in nursing homes who are exempt from recusing themselves from voting on the issues or sitting on committees for them?
Absolutely. I mean, there's an article published not too long ago about the individuals that either have nursing homes or are involved in some way in nursing homes, and they don't recuse themselves from those decisions. And they make decisions that are clearly a conflict of interest and in their favors. I don't have the numbers. They actually at one time did publish, not only who were nursing home owners, where the majority of contributions happen for nursing home lobbyists to some legislators, but clearly it's an issue, and I've never been able to understand how we have continued to allow, simply recusing yourself from those decisions should be common sense, but it definitely occurs.
Hey Kathy, thank you so much for joining us today, and appreciate your comments. Question, if we rank last in nursing homes across the entire United States, who regulates that? And is it contributory? The other questions, is it all tied together that we've got so much of a lobby and legislative involvement against these type of reforms? But how is that regulated and what can we do to improve?
Yeah, it is all tied together, and I believe, that and it's my former department, that is responsible for that. And it was very, very difficult. You go out, do surveys, and make recommendations, and oftentimes they get pulled back for whatever reason. And look, I'm not saying that all of that. I mean that it's done corruptively. it really isn't done corruptively, but there's just lots of pressure to, we need these nursing homes, we need to continue to work with them, and the number of nursing homes we've closed over the last however many years, I don't even know what the number is, because it's very, very few. Until this issue came up with Bob Dean, there were probably almost none over the last 10 years that were closed. So clearly, there needs to be pressure on the department to do what they're required to do in terms of checking that nursing home quality. But again, it's a difficult situation because it all gets intertwined with political pressure and other things that occur when you're trying to improve the quality. And like I said, the legislation, just trying to get some legislation to change our funding methods so there's more funding that's available for quality services and quality nursing homes, been very unsuccessful at that.
Be careful what I say because of my past experience, but there was a bill that was passed a couple of years ago that if there's budget excess in the budget, which there was as a result of all the COVID funds that we got, that money, a percentage of it, 12%, would be put into a fund that could be used for adult services. Has there been any progress in deciding how that money would be spent, and can home and community-based services benefit from that?
Yes, I mean, this year, there were 750 additional slots that were legislated because of that funding. It was actually one of the best bills we've passed in the last 10 years to get that additional funding. So yes, that does help. It unfortunately only puts a little dent in what's needed, but certainly it's moving in the right direction to have that additional funding. That goes, and again, as you said, it's 12% of surplus funding that is able to be used to designate home and community-based waiver slots, that community choices waiver that we're talking about. Thank you.